Having surgery under anaesthesia can be a bit daunting, especially if it's your first time. But you're in very safe hands. We're all highly trained and accredited specialist doctors, and we'll be by your side throughout your operation, watching you closely and keeping you safe. But there are a few simple things you can do to get yourself better prepared for your surgery. Every patient and every operation is different, which means your response to anaesthesia will be too. So there are a few things we need to know about you before your operation. Your general health and fitness. Any existing health conditions or allergies, any medication you're taking, any issues you or your family members may have had with anaesthesia in the past. And we need to make sure any medical conditions you have are being treated as well as they possibly can be. This may involve seeing your GP or your specialist if you have one. This is also a good time to raise any concerns or ask us any questions that you may have. The best thing for your recovery and healing is to stop smoking before your operation. The longer the better. Because the better you look after your body before your operation, the quicker it will recover. Of course, life doesn't always go according to plan. So if for any reason you need to postpone your operation, please let your surgeon and anaesthetist know as soon as possible. You'll be given specific instructions from your anaesthetist on when to stop eating and drinking, because having undigested food, or any liquids containing particles like orange juice for example, in your stomach may cause serious complications. Before you go into the operating theatre, we'll have another chat to check that you're comfortable and discuss any last-minute questions. You'll also need to arrange for a family member or friend to pick you up after your surgery, because even though you might feel back to normal quite quickly, it can sometimes take more than 24 hours before you can safely drive again after an anaesthetic. A little bit of prep before your anaesthesia can make a huge difference, so you can get back to what matters most. The Australian and New Zealand College of Anaesthetists, ANZCA, and its Faculty of Pain Medicine form one of the largest specialist medical colleges in the region. We are responsible for the training, examination and qualification of anaesthetists and specialist pain medicine physicians, and for the standards of clinical practice in Australia and New Zealand. Please note, this is general advice, and you should always follow the specific advice of your anaesthetist.